there is, as we've heard, a real lack of awareness in women in this age group, and there is, I believe, a real opportunity to save more lives from women dying of breast cancer here. And so we need the evidence. We will only get the evidence around the impact of screening in this age group if we extend the trial, and that is a really important investment.
What do you think, Jenny?
So, I mean, I think Dennis was noting the number of women. So in 2011, the Department of Health announced that the screening trial would be extended for two cycles. So that means actually, instead of finishing in 2012 in terms of recruitment, it's 2016. So it delays the period a little bit until we've got the results, but it now includes 1 million additional women in the 71 to 73 age group. So not insignificant numbers of older women, I think, joining in. And I think we need to run this alongside a number of other initiatives that are ongoing. So we've had in the last couple of years rollout of digital mammography, probably more relevant for the younger group, but one of the interesting points about this is, of course, it changes slightly the evidence base, because when we're looking back historically over data, we're looking at a lot of mammography and outcomes for breast cancer that happened in the old system, whereas now we've actually got new technology.
Well, I don't think
higher diagnostics.
It's very short.
I think we need to get this in perspective. NHS England are considering a new cancer strategy for England. It would be absolutely a really positive step forward if they were to make more resources available for public health here and invest in further evidence gathering on screening for breast cancer. It's the most common cancer in women. We lose 12,000 women in the UK a year because of breast cancer. If we're going to focus on early diagnosis in this new cancer strategy, this would be a great place to start. And I think that they may well be overlooking this.
Jenny did mention the possibility of false positives and unnecessary invasive treatment, which is no fun at any age, but particularly difficult for older women. And that has to be acknowledged too.
Absolutely, and that's why that's why the evidence is so important, and we can't gather the evidence on that if we don't do the research, and that's why I want to see this trial extended.
Very, very briefly, as you're both here, there was a story in the Mail on Sunday yesterday with, I don't know if you saw, about the thermal imaging mammography, about Sarah Wollaston, who's a former GP and Tory MP, was commenting on this. Anything to say about that?
I have to admit I didn't notice that. I did just want to make a comment perhaps on just some other things that we are doing, because I think this importance about the evidence base. Dennis and I are in exactly the same place. Clearly we want to prevent people dying, we want them to get to their GPs early. We know if they get their stage 1, they've got a 93% 5-year survival rate. If it goes to later disease, stage 4, it's going to be down to about 13%, so really important. But I think one of the other findings, so there are a number of recommendations that came out of the all-party parliamentary group on breast cancer screening. One of the other things that we've been doing in Public Health England is around data, and that we've made huge strides forward in this, which will ultimately provide a really good evidence base. So since Public Health England has pulled a lot of cancer registries together, we now have a national cancer registration service, and we've got unequalled information across the world on cancer. So we'll be able to, as we go forward, not only use this trial, but actually look at age and data and treatments across that to provide additional forms of evidence to support programmes.
I think it's pretty clear that in terms of survival rates, Britain's got some way to go, hasn't it?
Yes, it's not bad, but given that we have opportunities, we have good health services, I think we can all aspire to improve. And the most important thing actually is to get people into the services as soon as possible.
Jenny, thank you. Dennis, thank you very much for your time, and of course we welcome your experiences on this very, very difficult subject, I know, for a lot of people, but if you have been through it and you'd like to comment, do let us know. Now to Asda, the supermarket, which, as many of you will know, is facing an equal pay claim from up to 6,000 largely female shop floor workers. And last week, 4 women who work in the same roles at Sainsbury's took a similar claim to a preliminary hearing of an employment tribunal. Now, both cases rest on the idea that female-dominated shop floor roles are actually much the same as male-dominated roles in a distribution centre. But no prizes, I'm afraid, on offer for guessing who earns more. Let's talk to Sarah Veal, who's the Head of Equality and Employment Rights at the TUC. Sarah, good morning to you.
Good morning.
Now, let's first of all start with the different roles here. Well, actually, that's my first question. Are these roles any different?
Well, that I think would have to be tested in court, and that's the point of going to court. But it seems highly likely, given previous equal pay, equal value cases, it'll turn out that the jobs done by the men actually don't contribute more to the value of the supermarket than the jobs done by the women. And if that proves to be the case, then the supermarket is going to have to bring the level of the pay of the jobs that are done mainly by women up to the same rate as those that are done primarily by the men.
Well, last week on the programme, as part of our series on the lives of working women in the 21st century, we talked to some supermarket workers, and they were actually very honest about the physical aspect of their work.
It's so hard. You have big boxes of salmon that come in, and having to lift them, and I'm only 5 foot nothing, and they're massive. They're about the size of this table, and they're packed with ice, packed with salmon, and it's exhausting. By the time you've done all your setup in the bar, and you do go for your break, you don't want to go back because you're absolutely knackered, your back is broken, so you feel like by the time you're on your dinner, you just like wish it was home time. You shouldn't have to feel like that in a job. You should be ready to go after your dinner, but you're tired because it's a lot of heavy work.
I mean, as for instance, this week I've done 2 shifts of 11:30 till 9:30, and I'm on my feet all that shift, you know, running up and down. So when you get home, you are so tired. As I say, I'm 60 this year, so you know, my husband says you still think you're a young girl the way I dash about, because I don't take things slow. I do put a good shift in. But the long days when you're on your feet all the time and you're on the go all the time and you're juggling, really. You're juggling people about to make sure they get the breaks. You have relief operators on tills all the time now. We used to have them for half an hour. Some of them spend their entire shift on the tills, and they have their own job to do, which I can understand their frustrations when they say, no, can you get me off the till, can you do this? But I'll try, but I need to hit this figure as well, and that's the important part, getting the customer through the tills quickly.
Well, they are some women who work in supermarkets in Leeds. We're not going to say which particular supermarkets they work for, but that gives you an idea. It does actually give you a really good idea, Sarah, of the physical graft involved in these sorts of jobs.
Oh, absolutely. And the days are gone when those sort of jobs were just the preserve of men. I mean, there are many, many women now doing jobs that are physically very arduous, just as that woman was describing just now. So any pay anomalies that pick women out and give them less money are completely wrong and very, very old-fashioned. It's very disappointing that supermarkets have been, litigated against on equal pay grounds for a long time now, but they still haven't got round to doing a big overhaul of their basic structures and their systems and looking at who works where and making sure that they iron out any of these sex discriminatory pay anomalies that they clearly still have.
I better bung in the statements from the companies involved. Sainsbury's say we are aware of a very small number of claims in this case. We pride ourselves on being a fair employer and do not recognise discrimination of any kind. And of course I did make it clear at the beginning, we are talking about 4 women who work at Sainsbury's and they have brought a case. Asda, many more people here, thousands, but Asda do say any accusations that Asda is paying women less than men because of their gender are absolutely false. I have read as well though that some people, Sarah, are saying that this is the 21st century made in Dagenham.
Well, it absolutely is. I mean, these equal pay claims have been rolling through since then, and we still haven't sorted it out, and we've still got 16% gender pay gap and a much bigger one for part-time workers. I'm really pleased to say that the government is going to be introducing new legislation which will say that for all organisations, public and private sector, that employ more than 250 people, they are going to have to do annual equal pay audits. Now, we haven't seen any of the detail, but even if it's a very crude snapshot of pay across the company or the undertaking, the organisation, it will, I think, at least give the employees the opportunity, and the trade unions who represent them and any lawyers who've got an interest in this, to see what the pay scales are like. And I think it'll be much easier then to identify these sorts of anomalies that still treat women as second-class citizens. So I think there's going to be a lot more voluntary pay auditing and a lot of rectifying of these anomalies taking place fairly soon. And it shows that you do need strong laws, and you need governments of any political complexion to keep on relentlessly pushing this, because we can't carry on with, me coming on Woman's Hour for 6 months and you doing a fantastic job covering the issue and nothing really shifting.
Well, I'm not sure our job is that fantastic if nothing really shifts.
Well, it is beginning to shift, isn't it? I think we're getting there.
Okay, I
mean,
slowly. We're not talking here, as we know, about people who are highly paid. I'm just looking at, I must be absolutely specific about what I'm talking about here, but Sainsbury's shop assistants are paid between £6.61 and £6.97 per hour, and Asda shop floor assistants, the hourly rate £6.75. This though will change, will it not, when the new living wage comes into force, £9 by 2020 an hour.
Well, yes, indeed. And when the national minimum wage came in